Good morning, everyone. Welcome to another question and answer session. This is one that we've covered a while back. We haven't covered it in a while, but it keeps popping back up, the question of silicone versus saline. So we're talking about breast implants, obviously. There are two main categories of breast implants. Implants filled with silicone, which is kind of a gel-like substance, and then implants filled with saline, which is a saltwater filled implant. The short answer is that for certain patients, they can look fairly similar, and those patients are patients with a lot of breast tissue. For patients that don't have a lot of breast tissue, if you're an A cup or a B cup, the silicone is going to look a lot more natural. It's going to feel a lot more natural than the saline implant because the silicone gel is closer to the fatty tissue that is part of a breast. A saline implant obviously is a little bit firmer because the salt water has to fill the implant fully, and then it becomes a little bit tighter. So if you're relatively thin, if you have an A cup or a B cup, or you just want the most natural looking and feeling implant, you're going to want to go with a silicone implant. There's a question about which one's safer in terms of rupture. Well, the reality is that they're probably pretty comparable. The saline implants have to be filled to a certain amount, and if they are underfilled or potentially overfilled by a significant amount, they can rupture more readily. However, if you have a silicone implant and the shell ruptures, the gel just stays there. You won't even know that it ruptured unless you get certain studies like a CAT scan or an MRI, or you have surgery. Saline implant, if it ruptures, it just goes away. So it just deflates. And then once you just lose all the volume in there, and the volume just gets absorbed by the body. So in that regard, maybe saline implants are a little better because if it ruptures, then you know it ruptured and you can go and have it replaced. Incision size, well, a saline implant comes deflated, and so it can be rolled up in a very small amount, placed in the pocket that we create during surgery, and then filled up to the right size. The silicone implants come pre-filled, so the incision has to be a little bigger if the implant's bigger. For example, if you're doing, let's say, a 500 cc silicone versus a 500 cc saline implant, the silicone incision's probably going to be about that big from here to here, and the saline incision is probably going to be maybe half. If the implants are smaller, let's say 250 or 300 cc's, and the size almost becomes very similar. So this one is not a huge deal because the incisions are oftentimes in the breast fold and hidden. However, if you are getting a very large implant, maybe a saline implant will be better if you're trying to keep the incisions as small as possible. Overall, about 99% of my patients ask for silicone implants, and they ask for silicone because at the end of the day, looking and feeling more natural is what's really important. So those are all the most important things that you have to know about silicone versus saline implants.